So it is the second most common cancer impacting men here in America. About 1 in 8 men will be diagnosed with prostate cancer in their lifetime, and thousands of patients are choosing to use radiation treatments after that diagnosis. And to help with that radiation therapy, some men are using SpaceOAR Hydrogel. Well, joining us today to dive through that is Dr. Jonathan Whitten. He is from First Urology on what men need to know if they get this diagnosis. And Dr. Whitten, what I'm really struck by is that number, that statistic is so high for men that can be diagnosed with prostate cancer.
Yes, absolutely. It's a scary thing.
Yeah.
It's a delight to be here on
thank you.
during Men's Health Month. About 250,000 men will be diagnosed with prostate cancer during the last year. And many of those, unfortunately, about 35,000 will die of prostate cancer. But we've got two main treatment options, surgery and radiation therapy.
And so after radiation therapy, is that where SpaceOAR Hydrogel comes into play? Obvious question here is what is it and how is it used?
About 60,000 men per year will undergo radiation therapy for prostate cancer. There are risks inherent with anything we do in medicine and surgery. So in order to try to cut down on the risks of radiation therapy, SpaceOAR Hydrogel is inserted between the prostate and the surrounding tissues, especially the rectum. And that helps basically limit the effect of radiation on the rectum.
Yeah. Any side effects from this treatment that you're seeing so far?
The side effect profile for SpaceOAR Hydrogel is very low. Of course, there's the possibility of infection. We give antibiotics during that procedure, but the side effect profile is really something that is a minimal risk.
Yeah, and then overall success rates, what are you seeing or hearing from men that have gone through this?
The success rates are fantastic.
Yeah.
It helps with future erectile function. It helps with preventing scary things like injury to the rectum or the surrounding tissues. And overall quality of life has been shown to be statistically significantly improved after the procedure.
Any risks of doing SpaceOAR?
Risks are very low. Yeah, I think the whole point of SpaceOAR is to avoid the risks of radiation therapy. It's a nice product. It's been around for a few years, and it's really quickly becoming standard of care.
Right, and you're seeing it more and more, obviously using it at First Urology as well.
Absolutely. It's a clinic procedure that we do in about 5 or 10 minutes. Very little discomfort. Most guys are leaving the clinic very happy with their results.
That's crazy to know. 5 or 10 minutes out the door, going on with your life.
It's a fantastic option, and it's one that we recommend for most men undergoing radiation therapy.
You know, we talk kind of in general about prostate cancer and the high risk of men that do get it, the high odds. Are we doing enough to kind of get out the word? I'm sure early detection, that's the key here, is knowing maybe I need to get screened.
Prostate cancer is a hard thing for many people to talk about. It's in an area of the body that not many people want to pay attention to in terms of disease or illness. But the more we get the word out, the more men we can treat successfully and prevent them from having a bad outcome with something that's very common in men.
Right, and what can people do if they're listening and they know somebody that has prostate cancer and they're interested, they have questions for you? What is the best way to reach you?
The first thing is to do is to have an open conversation and to be okay with sensitive subjects.
Yeah.
There are many urologists.
We can talk about it on Great Day Live, right?
Yeah, absolutely.
We can talk about it anywhere.
We have many urologists in the city, especially with First Urology, who would be, and we're all willing to talk to patients at any time about their risk for prostate cancer, if they have a new prostate cancer diagnosis, or if they just want to talk about the details.
Yeah, sometimes the most difficult discussions are the most important ones that we have to have.
I agree with that completely.
Yeah. Well, Dr. Whitten, thanks for stopping by.
Thank you very much.
I'm going to remind everybody, if you want to learn more about this gel and if it's the best choice for you, head over to SpaceOAR.com or FirstUrology.com.